Hello, everybody. Hope all is well. Welcome to the next section of phlebotomy. Today, we are going to talk about venipuncture complications and pre-examination variables. As far as what we are going to learn out of this chapter is we need to identify what complications can occur and how we should handle each situation. And if the patient does have a reaction or complication, such as a syncope or they pass out, what we should do in that state, and then how to handle reporting it. Also, hopefully you guys practiced applying the tourniquet, and we need to know we can only leave a tourniquet on for so long. Obviously, it'll cause issues for the patient. It will restrict blood flow too much, and so therefore we only want the tourniquet to be on for 1 minute maximum. As far as picking the vein, that's a big part of a possible complication. Again, if we draw from a vein that is near a nerve or we accidentally go too deep and hit that nerve, we need to know the appropriate way to handle it. Also, we need to know why we can't draw from a burn or scarred area, from a vein where there's a hematoma, which is a previous injury or bleeding underneath the vein that can alter test results. And also if there's history of mastectomy or fistula, we need to be aware of that with each patient. All right, so basic complications here. The complications for routine venipunctures can occur at any step, not just when the needle is in the vein or after collection. It can be on a requisition form, which is the test order, patient access, identification, site selection, and collection. Very important to make sure that we have everything according to which lab they're using. We need to have everything in the correct order. We need to have the identification match up with the patient. We need to make sure that there's no information given to the patient about test results or talked about with the diagnosis, things like that. A lot of tests are fasting tests, and so that means typically no food for 10 to 12 hours, and that is commonly used by doctors for cholesterol panels. There's certain hormones, and so if you've eaten, obviously it'll affect your blood sugar, and so it's important to see if the doctor ordered the test to be fasting or not. And so always important to ask the patient, have you been fasting? And to make sure that it matches the order. Some tests, they don't need to be fasting. Some tests are time of day. Certain hormones need to be drawn first thing in the morning before 8 a.m. There's also a lot of things that can alter test results, not just food or time of day. Sometimes it's position. Certain tests require the patient to be in an upright position. Some require them lying down. And so again, it's important to study which tests need to be drawn and to know the appropriate protocol for those tests. Also, exercise, that can affect many things. Lactic acid is the most common test it can affect. So some tests require the patient to have not exercised within a certain amount of time. And so especially if there's strenuous activity, that can alter the test results if it's done right before the blood draw. Stress can cause many things, as we know, but it can cause certain levels to be higher. So if they're really stressed, it can cause a reaction to their cortisol levels, ACTH. These are hormones, even white blood cell counts, and iron levels, and especially arterial blood gases. So I know it's hard to ask if you're stressed. Typically, the doctor will explain this to the patient if there is a high amount of stress that it can alter test results. But if you can clearly tell that the patient is under distress or in a lot of pain, it's good to make note of that. That way, if test results come back a certain way, we can cover ourselves and say, yes, the patient was under a high amount of stress. And that way, it's just a note for the doctor as well. Alcohol can cause test results to alter, especially glucose. And so if you can tell the patient's been drinking, again, it's not our job to ask them if they have, but if it's obvious they have, make a note of it, and then we can put that into our notes for the provider. Smoking also can cause some complications with blood tests, and so it's important if you do smell smoke from the patient, that you make a note of it. It's just to protect us. That way we know if we need to, if the doctor does ask, that we have a note on file that yes, they went out and took a smoke break right before the test, which the doctor should teach them that that's not appropriate. But again, always important to take notes to anything out of the norm or that can alter test results. It's good to have that written down in our file. Time of day, that's a big part of blood tests. And so often they will require a morning fasting, or they may be done after 3 p.m. Every test has a different protocol. And so typically the doctor would explain that to the patient, but it's our job to have the knowledge to know which tests are done at certain times. And that way, if they come in for a blood draw and say we draw them in the afternoon, we can say, nope, I know that a cortisol or testosterone test is supposed to be done, first thing in the morning. So it's our job to have that knowledge. But again, they should be educated by the doctor when they come in, but it still happens from time to time where we have to say, nope, you have to come back. You haven't been fasting, or it's too late in the day. And so very important to know that information. Medications can alter test results. Again, the doctor should go through this with them. It's not our job to ask them about their medications, but if we're doing specific blood draws, there is a protocol where we may need to ask those questions, especially if it's for drug levels. We need to know the last time they took their medication. That way we can put it in the notes and make sure that it's the appropriate protocol for the test that's being done. Sex hormone levels, they vary with sex and age. Again, and time of day. So a free testosterone should be done. It's most accurate first thing in the morning before 8 a.m., as well as other certain tests, certain times of day. Again, it's important to have that knowledge. Altitude can alter your red blood cell count and your hemoglobin. So there's certain areas where it's recommended if you travel and you work in a high altitude area, to keep that in mind so they can factor it in with the test results. Dehydration, that's a big one. Obviously, if a patient's dehydrated, that can alter many levels and also alter the blood draw. We want them to be hydrated, their veins to be full and pumped. And you'll notice when you apply the tourniquet or you look at a patient that's dehydrated, it will be obvious to you. You'll see that the veins aren't popping up. And so dehydration is a common one. A lot of patients don't know, especially if it's a fasting test, that they can still drink water and that they need to drink water. They need to come in hydrated. It'll make the draw much easier. Fever or pregnancy, obviously those can alter test results as well. Fever can alter your white blood cell count, so it can come back, their white blood cell count is very high and the doctor may not know why. So if they actively have a fever, they should not be getting their blood drawn for a blood count, because that can alter the results. And if they do, we need to know, and the doctor needs to know as well. Pregnancy can alter many hormones, many tests. Most women know they're pregnant when they come in and will let you know. But when they don't know they're pregnant and some test results can come back, it can confuse the doctor and therefore need further testing. Patient complications. You may have apprehensive patients. A lot of patients have a needle phobia. They don't like their blood drawn. It makes them very nervous. They may be scared of what test results may come back. And so it's very important to accommodate to each patient, make them as comfortable as possible. And if you need extra assistance for them, if you need to get them an ice pack or have them sit down for a while after, it's very important to accommodate each patient because we don't want to risk them passing out or having a syncope or any reaction to where it may alter the blood draw. Seizures, you always immediately remove the needle and tourniquet. You will know, typically you'll start to recognize the signs and symptoms if a seizure is going to occur, as well as a syncope. And if you start to see those signs, just withdraw the blood draw, withdraw the needle, and make sure the patient's in a safe environment. You can get a petechial rash, it's petechiae, which are little small red spots, and that can be from having the tourniquet on too long. So it's just a little bit of bleeding underneath the skin. And it also may be due to a blood disorder they may have. Allergies. Always important to ask if they have a latex allergy. They may be allergic to a topical tape or adhesive, as well as even alcohol pads. Always important to ask if there's any major allergies. Nausea and vomiting, that can happen with a blood draw. A lot of people get nervous. It can make them feel sick. And so if they do start to vomit, again, remove the tourniquet and needle as soon as possible. And it's always good to have a emesis basin nearby. That way you can collect the vomit if that were to happen and just work on the patient's breathing as well as applying a cold compress. Every patient has a right to refuse blood draw, and so if they say no, then it's not our job to tell them they have to. They can refuse. However, most of the time if they come to the lab, they have already agreed to do it, but it does happen from time to time, and that we would just make a note and let the doctor know. Tourniquet application, very important when you apply the tourniquet to watch for skin conditions or open sores. Sometimes you can use a blood pressure cuff as a tourniquet, and that can apply extra pressure, but it can also cause hemoconcentration, which is prolonged tourniquet time. You can have hemolysis where there's damage to the cells, and so it's important to have the tourniquet on for less than a minute, and if it is on too long, we need to make a note of that and know that it can alter test results. Site selection, very, very important. If you can't locate the veins easily, then you probably shouldn't draw from them. It's important to check both arms. You need to be confident with the vein that you're going into. We never want to poke somebody without the confidence. And so we don't go in blind. It's very important to find the vein. And if it takes a little extra time, take the time. There's things you can do. Gravity helps. You can have them dangle their arm, have them apply pressure, squeeze their hand. You can add heat to the site. Often there's heating packs in the lab that can help bring the vein to the surface, as well as hydrating, making sure that they drink some water. These are just little techniques that can help you. Areas to avoid: decreased blood flow. You can tell if their hands are cold, then you probably don't want to draw from their hand. Their blood flow is going to be decreased. You can heat it up, have them run their hands under hot water or use a heating pack, but always important to make sure that there's a good amount of blood flow for our specimens. Infection, we don't want to go into a contaminated area because that can alter the test results and also make the infection worse for them. Damaged veins, especially people that go in frequently for blood draws, they can have a lot of scar tissue built up. And so it's really important to try and stay away from that because you may have difficulty accessing the blood flow if there's a lot of scar tissue. Hematoma, blood underneath the skin. You don't want to draw from a hematoma because the blood you may get is not it's not the blood that we want. It has already clotted and it's just accumulated underneath the skin, not actually from the vein. And so you always want to draw below a hematoma if you have one. Edema, you can have excess tissue fluid. We want to be careful if somebody comes in really swollen. Obviously, that's going to alter